start introducing, sir.
Okay, ma'am.
Okay, we have now started live streaming. We have more than 75 doctors already logged in. So, Mohsin, you could just introduce Dr. Matre, and then from there we will start the session.
Good evening, everyone. A very good evening to all of Invent Doctors. Thank you so much for joining us today's webinar. Our endeavor is to spread awareness about rabies, which is fatal but can avoid it once appropriately vaccinated. This is an initiative from Cadillac through its innovation to serve the society and humankind. The topic of webinar is dosage reduction strategy in rabies management, role of novel vaccine. Dear doctors, rabies is the world's first novel 3-dose anti-rabies vaccine with great pride. We would like to inform you that rabies has successfully completed 1 year of launch with more than 40K animal bite victims. Being vaccinated 100%, compliance was recorded and no case of ADR was registered. With this, it's my honor to introduce
Hello.
you to the speaker of today's webinar.
काहीच आवाज येत नाही.
Mohsin, your voice is this just. Okay, I hope I am audible better.
Yeah.
Yes. Okay, I'll just, Mohsin, I'll just take over from here because I think there is a slight problem in the
Okay,
connectivity at your end.
चालू
Thank you all doctors who have logged in. Thank you, Dr. Matre. It's my honor to introduce you to the speaker of today's webinar.
Specialty is MD of Rajawadi Hospital and Associate City Hospital, Sustrit Hospital.
We would really like to welcome Dr. Kiran Matre for this webinar. Like Mohsin just mentioned, he's an MD medicine, has an immense long time practice with special interest in cardiology and diabetes, an experience of more than 25 years where he was also honorary doctor at the prestigious Rajawadi Hospital. Sir, over to you so that you can start the session. And thank you all the other doctors for the patience. And we start our session on RABIES, world's first 3-dose rabies G protein vaccine. Thank you.
Yeah, thank you. Thanks for that kind introduction. Now, today's topic is rabies. It is a zoonotic disease which we observe day in and out. So many dog bites are there. So the title itself is dosage reduction strategy in rabies management. So rabies management, the only vaccines are there, rabies vaccine. So the role of vaccine in dosage reduction. So these are the contents on these topics we are going to discuss. So rabies disease, what is this? It is a rabies virus. And it's a zoonotic disease which is caused by rabies virus. It is encoded by 5 structural proteins. As you can see in the diagram, N, P, M protein, L protein, envelope RNA which is inside the virus, and G protein. Now, what is this G protein? So G protein is a major antigen in the formation of neutralizing antibodies against rabies virus. So this is a basis of this vaccine. So globally, almost 59,000 rabies deaths per year. In India, almost 20,000 deaths are observed. 91% of the deaths are in the rural areas. So rabies is 100% fatal, but 100% vaccine preventable disease. So vaccine should be started immediately, and a complete vaccination schedule should be given to the patient, which will benefit him, because if you delay or don't give 100%, the mortality is there. I will like to add one comment. Only one case we could save in Somaya Hospital by using Acme, a case of rabies. But that was only one case in my entire career of 25 years. Otherwise, the rest of all cases had a mortality. So how the rabies vaccine has evolved? So initially it was live attenuated vaccine, which acted on spinal cord. So what is this live attenuated vaccine? The virus is taken and it is a weakened virus which can grow and replicate, but it cannot infect. So that virus they use, and that was introduced. So it created a dummy infection, uh, creating antibodies. But it was a non-standardizing dried preparation, and almost 31 injections of increasing immunogenicity were introduced. But that was way back in 1885. In 1911, the inactivated vaccine came. What is this inactivated vaccine? Was the virus was taken, it was the inner material was destroyed by either by using radiation or heat, so that it cannot replicate, it cannot infect, uh, but it can uh, give a content to produce the antibodies. So this was way back in our childhood. uh, we used to get all these vaccines in public hospitals, where 14 injections, 0.5 ml daily was given in the subcutaneous tissue of abdomen. So the minimal neural content with liquid preparation. Now, the 1976 was a major breakthrough in developing rabies vaccine, where cell culture, uh, more than 2.5 international units was used. So it had a standardized immunogenicity, lyophilized preparation was available, and 5 injections which we were using till date. So zero point 0.5 to 1 ml depending upon the age group, were given on 0, 3, 7, 14 and 28 days. Now this vaccine basically, the virus was grown on the chick embryo uh, culture, and then it produces the basically an rabies neutralizing antibodies, and that acts on rabies virus, and it prevents the further progression of the disease, and it doesn't allow the virus to replicate, and thus how the rabies was eliminated. So these injections we are using till now by various brand names, Rabipur and so on. uh, so now what were the challenges in this? So current rabies vaccine are cell cultured vaccines. So they are inactivated vaccines, almost more than 50-year-old technology, inconsistency in potency, stability, short supply, various adverse events were observed. So decreased compliance beyond 3 injections was noted. So most of the people used to disappear after taking 3 injections of rabies vaccine, and then of course because of the cost and incompetence, both the things were uh, basically responsible. So it had still the mortality chances were high. So uh, now going to fourth and fifth injection, where the compliance was a major issue. So as you can see in this diagram, almost 47 to 54% patients were not taking fourth and fifth injections. So that was a major challenge in administrating the cell cultured vaccines. So meeting the unmet medical need, now the Cadiga is introducing an novel vaccine with simple and shorter regime. So what is this? Introducing the rabies. The vaccine name itself is the rabies. So it is a recombinant rabies G protein vaccine. So they have used rabies G protein for preparing vaccine. So it is the first protein subunit vaccine prepared by VLP platform technology. What is VLP? Is virus-like particle platform technology. So it is the first vaccine which comes with 3 doses, intramuscular uh, route of administration, on given on 0, 3 and 7 days. So lesser the number of doses, better the compliance. So better compliance due to easy to flow regime and less visits. Convenience was there, ready to use, and no reconstitution was needed. Uh, Cell cultured vaccines which were available till date required an reconstitution. So that was not required in this vaccine, which has been introduced in recently last 1 year. So what is this VLP, virus-like particle technology? So this is the native virus of rabies. So the G protein is difficult to stabilize. So G protein isolation was done using virus-like particle technology. It was purified, stabilized by Cadiga. Then these VLPs are similar to native virus particles, but they do not contain the viral genome. So no viral genome, so no infection. So these VLPs like virus-like particles are protein complexes. These are exist as nanoparticles. So they cannot replicate but can mimic the viral antigenicity without being pathogenic. So this helps in development of immune response. So capable of inducing strong humoral and cellular. Cellular immune response is like they will the cellular immunity we get, and humoral by producing the neutralizing antibodies. So VLP has vaccines. So this was a concept behind developing this. So they use that G protein, which is a major antigen protein. They created some virus-like particles of this G protein, which induces the immune response, either humoral or cellular. So cellular response, the lymphocytes and histiocytes were produced, and humoral was rabies neutralizing antibodies, and this were deactivating the rabies virus. So this was the original research article on novel recombinant rabies G protein vaccine, the rabies, a VLP-based rabies vaccine. This was introduced in June 2021. This article was published. So this was a clinical phase 2. So what they compared was 2 doses versus 3 doses. The dose was 10 milligram, 10 microgram and 50 microgram. So what they observed is almost a very good immune response to this rabies vaccine, which was developed. But 3 doses and 50 microgram was better as compared to 10 microgram. So then they moved to November. The article was published about clinical study of phase 3. So what they safety and immunogenicity of novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization. This was a randomized comparator controlled multicenter phase 3 clinical study. So this study was to evaluate the immunogenicity and safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. So it was a randomized, comparatively controlled multicentric studies. Total subjects were 800. The randomization was 2:1. So 037 regime where 533 subjects were given was compared to Rabipur, that is cell cultured vaccine, total 267 subjects, and this regime was 5-day regime, like 03714 28 till now we were giving them. So this study design and objective was to demonstrate the non-inferiority of the test vaccine compared to the comparator vaccine, which was inactivated cell cultured vaccine like Rabipur and so on. So the primary objective was whether we get adequate seroprotection at 14 days post first dose, and secondary objective was whether we are getting in seroprotection at day 42 after the first dose test vaccine, safety by monitoring subjects with adverse events. So what they observed in efficacy, both the vaccines had very good efficacy, almost 99, 97, and by day 42 it was almost 98.69 to 100%. So results were consistent across different age groups and genders. Observed differences 1.52% with pre-specified margin of -4%. So crux of the story is non-inferiority for seroprotection. Primary endpoint of day 14 and 42 were made. Test and comparator are identical in seroproduction protection rate both on day 14 and 42. So equally effective to the vaccine which was used till date, the cell cultured Rabipur vaccine. Coming to safety, the adverse events of the rabies and Rabipur were compared. So there was a major decrease in adverse events for the rabies rather than the Rabipur, like localized pain, redness, swearing, fever, ear pain, headache, urticaria, joint pain, and nausea. So all these adverse events were lesser. So the rabies had better safety profile as compared to reference vaccine, which was Rabipur. So what was the conclusion of the study? The rabies was non-inferior to reference vaccines, less adverse effects compared to the reference vaccines, and novel 3-dose the rabies was found to be safe and immunogenic and was comparable to 5 doses of WHO pre-qualified vaccine. So it is equal to the previously used Rabipur and so on, or Rabivax, uh, which was 5 dose regime, is as good as 3 dose regime of the rabies. So both were uh, end-to-end compared in almost 800 subjects, but total they found it is equally effective and less adverse event. So that was added advantage. Plus the compliance was an issue for 5 doses because of cost or whatever reason. Uh, Now in 3 doses it is not the issue because it is 037. So within a week this vaccine is over and you get a good protection. So for this uh, innovation and discovery, the this pharma got an award by Economic Times, and Golden Globe Tiger Awards in Malaysia was received. So this was overall about the rabies vaccine.
Thank you, Dr. Matre, for taking us through this whole this. I just thought I'll tell you more than 75 doctors have logged in. So thank you so much, doctors, for having logged in for this lecture. And there are a few questions which have been asked. And any other doctors having any other question, you will find a chat box where you've logged in. Just drop in your question there. I will take the questions one by one. Couple of doctors have written that they have tried Thrabis and they are very happy with the results. There is Dr. Siddharth Mishra who is asked about whether compliance will be an issue even with 3 dose or what. That's one question.
No, I don't think so. Where the question of life and death with no treatment available, I think 3 doses patient will happily take rather than 5 doses. Plus the economy matters. So 3 doses it is definitely economical as compared to the 5 doses. So 5 visits compared to 3 visits within a week. So the follow-up is also justified. Like the patient can come after 3 days and again after 3 day, third day. So within a week, by Monday to Sunday, the vaccine job is over and patient is free to go and he is tension free also.
Thank you, sir, for the reply. There's one question which is coming in is, what has your experience been with this product? And also one Dr. Pramod Tiwari has asked, can we give it to pregnant women?
Yeah, absolutely. The even Rabipur is safe in pregnancy and lactating women. So it can be safely given. Only thing you have to consult your gynecologist, and of course the rabies doesn't have any choice because the 100% mortality. So, and it is safe. So whatever studies they have conducted, they have not found any adverse event or mitogenicity or abnormality in utero as well as post-birth for lactating mothers. So that is absolutely safe because it is inactivated cell cultured vaccine. So it is not going to infect the patient plus a good immune response. So it is safe. Both the vaccines are safe in pregnancy and lactating mothers. Definitely.
Sir, Dr. Nalini Deb has asked subcutaneous, can it be given subcutaneously or intramuscularly?
No, it has to be given intramuscular, madam, and that too we prefer on deltoid. Many people give it on buttocks, but that is the absorption is erratic in buttocks. So it is preferable to be given in deltoid, 0.5 ml dose. Another thing, like in Rabipur, the dose is 1 ml for adult and 0.5 ml for a pediatric. So here again the advantage of lesser the quantity, lesser the painful, but it has to be given in deltoid and intramuscular. Subcutaneous is not advised and not recommended also by guidelines.
So, sir, you're saying Thrabis should be intramuscular only and deltoid is the better way of giving.
Yeah.
Sir, Dr. Abdul Qadir Khan has asked a question whether have you come across any hypersensitivity case reported with Thrabis?
At least whatever I have used, no. I don't know about the others. Others should also come up. There are 70 doctors on the platform.
Yes.
So most of them must have used, but at least with Rabipur also, we have not observed any hypersensitivity reaction till date, because Rabipur we are using since almost 1 decade or more than a decade. So no anaphylaxis or hypersensitivity reaction was observed. And the rabies also, whatever I have used in the last 4 to 6 months, never I have observed any hypersensitivity reaction. So it is safe.
Dr. Nalini Dev has one more question for you, sir. She has asked, how long does this effect last? And I think any allergic, you have already addressed that, but I think effect for how long is what she would
See,
like to know.
you get a seroprotection by day 14 to 42 days, and it lasts for 5 to 6 years minimum. But there is a this question comes whenever the patient is vaccinated, post exposure vaccination is completed, and then again there is a rebite by a stray dog within 6 months or 1 year. Then this question arises. So whether to revaccinate or not. But the answer is depending upon the severity of bite. If the bite is on face or upper extremity or neck, uh, or it is a deep bite with a flesh coming out, or which requires an CLW, that is the stitches are required for such bad wounds, definitely we recommend to take it again. Or otherwise then you have to do an rabies virus antibodies, which is available with Metropolis, that is costing some $2,800. So do this test, find out whether you are in the therapeutic range or not. If you are not in the therapeutic range, then you can reintroduce the vaccine to this person.
There's one more question, sir, for you. The doctors are really interested. So many questions coming in. Very interesting. Any booster is a question which has been asked.
So same, the efficacy lasts for 5 to 6 to 7 to 8 years. So whenever the booster is not usually recommended, but only recommended for the people who are working in maternity hospital, or those who are coming working for stray dogs in municipality departments. So for them the booster is required. So what we used to give, or by recommendation, every 5 years it has to be given. But what my advice is to do a rabies virus antibodies, and find out what is the level, and then you decide whether the booster is required or not. Because this is not required by routine persons, required by persons who are exposed to dogs, veterans, or the working with municipality department to catch those dogs and immunize them.
Very interesting. Thank you so much, sir. So we'll just wait in for a couple of more minutes to see if there are many questions, because you already addressed quite a few questions. So I'll just see for a couple of more minutes. Otherwise, then it would be, but sir, it was very interesting, the talk which you gave. And you started by saying that in your so many 25 years of experience, you have never seen, I think you said only one person.
One person was successfully revived by ECMO, and he was lucky enough to came out.
Okay. Otherwise, I don't think anybody ever can survive, right?
No. It's that's why they say 100% mortality. So whether you get a rabies or not, that is another question. But it's best to take a vaccine and finish up the then there will be no worries.
That's very interesting. Like I'm sure when such experiences are shared on this platform, not only do we get to learn more things, we also get to understand how things happen across the country.
Because vaccine is the only answer and treatment available. There's no treatment.
Dr. Nalini has asked for the cost. Ma'am, I will ask my medical representative and my FO to get in touch with you, and they will immediately let you know the cost for the total product. But I can just say that the total costing of it is almost equivalent to the 5 dose. Rather, it would be more economical if you consider that the patient has to come 2 more times to you for 2 more injections. The going and coming cost and all, if I consider it, it becomes even more economical. But I will still tell my team to get connected with you. So thank you, Dr. Matre, so much for this wonderful, informative talk. Thank you, the audience, for having taken out time from your busy schedule to join us, to understand and join us this moment of rabies-free India, which is a movement which has been actually started by Dr. Modi, Narendra Modi as well, to ensure that by 2030, India would be rabies free completely. We truly appreciate all the doctors who joined us and Dr. Matre in particular for taking us through this. And like you just saw in the last, RABIES has won not just one, but two prestigious awards, and that too in the innovation category of ET Pharma Award and Golden Globe Tiger Award. Just reiterating, it's 037 dosage. So in 1 week, like Dr. Matre said, it can be completed. Dr. Nalini again thanks you, Dr. Kiran Matre, saying that it was a very informative session. So thank you so much, sir.
Thank you. Thanks.
Thank you all those who joined us on the platform. Any other questions, if you have, please do drop into our mail. We will surely get in touch with you, or our team members will get in touch with you. Thank you so much. Thank you, doctor.
Yeah. Thank you, madam.
खूप छान वाटलं भेटून. Thank you so
Okay.
much.
Okay. Yeah. Thanks. Thank you.
धन्यवाद. खूप छान.
Yeah. I will quit, madam. Huh?
Very interesting. Yes. Now we can start to log out.
Yeah.
Thank you.
Yeah.
धन्यवाद.
Progress.